Hello, my name is Caroline McMahon from Caroline's Angels Baby Sleep Specialist, and this week's video we're going to talk about transitioning your toddler from 2 sleeps to 1. We would usually expect your child's age to be between about 14 and 16 months, although there's variations on this, so that's about the age range that we're looking at in your child. What you may find is that your child might present in differing ways to your friends' children or other people that you talk to, so don't feel that it's not happening to you if it's not the same as your friends. Some of those ways that you may notice that your toddler is getting ready to transition from 2 to 1 sleeps might be that they go down very easily for their morning sleep, but have difficulty in the afternoon, and they may in fact not sleep at all in the afternoon. So you've got this very long period from their morning sleep through to their evening settle where they haven't slept again. You may find that they settle quite beautifully for both their day sleeps and quite a reasonable amount of time, but they struggle in the evening, that from being quite easy to settle their usual way to being completely unsettled and quite a chaotic evening. You may also notice that they will get long periods overnight where they're awake and simply nothing will get them back to sleep. And you might find some things coming back in that, you try and feed them, or you think that they're in pain, you're giving them Panadol. Just different things that you haven't had to look at for quite a while might start to creep in very slowly. And if you look at last week's video on early morning awakenings, if your child is getting too much sleep in the day, it may be manifesting with an early morning awakening. Something else that might happen is that your child, you go to put them down for their morning sleep and they refuse, or they simply can't fall asleep, that you find that they have the ability to stay awake longer and longer each day, probably past 10 o'clock in the morning. So if that's happening to you, then they're probably the things that I would be looking for in a child that is starting to ready to transition. So for some of you, your child might very simply go to 1 sleep a day without too much bother to either of you, and you'd be aiming to get them past 11 o'clock. Ideally about 11:30 they'd be going to bed for the day for 1 sleep, and they'd have an early lunch before they go to bed to help them be able to sleep for about 1.5 to 2 hours. In that day sleep, once you feel that your child can sort of fairly regularly get to about 11:30, the aim is to get them to 12 to 12:30. That's where we want that 1 sleep a day to sit. So if you can only get your child to 11:30 initially, just let them settle into that pattern, let their body settle down, and then you might start incrementally putting them back by 10 minutes later, every 3 or 4 days, until you get to sort of a comfortable 12:30 where you feel that it suits your child. If, however, you find that your child is not quite ready to go to 1 sleep, although they're showing tendencies to want to do that, what you can do is still offer a morning sleep, and you may just offer a little 30-40 minute nap, just enough to let them rest, just take the sting out of them and salvage their afternoon sleep. Especially that's a good tactic if you find that your child is sleeping in the morning but finding it difficult to settle in the afternoon, or they don't sleep at all. Then just give them a tiny little, just enough of a rest in the morning and then a longer sleep in the afternoon to help them get through. What you may find is also you may need to look at the timing that they get up in the late afternoon, that if they're not getting up till 4 o'clock in the afternoon, they may still struggle getting to sleep in the evening. So by shortening that morning sleep, that afternoon sleep comes forward a little bit further, and you've got that bigger gap that they can then manage to be tired enough ready to go to sleep. Around 12 o'clock, around 12 months of age, you'll find that a lot of children are starting to walk or preparing to walk, and they're quite a busy little age, and you may feel that your child is quite ready to drop down to 1 sleep at that point. If you can, try and get through that very busy period once they're learning to walk, and see if you can maintain the 2 sleeps, because their legs are busy and their brain is busy trying to get them to master walking. They may just drop the amount of sleep they need for a couple of weeks or a month, and then if you still feel that it's not settling down, you'll be getting probably a little bit closer to that 13.5, 14-month period that in fact they may need to go down. And probably most children by about 18 months have managed to drop down to 1 sleep. So hopefully that will give you a bit of an insight into the timing and age of when children drop down to one sleep. If you feel that you have dropped your child's sleep and the amount of sleep in the day, please always remember that wind down time in a toddler is really, really important. They're a very active age. They're running around, they're absorbing language and stimuli around them, that it is difficult for them to settle. So have that period for 15 to 20 minutes prior to their sleeps where you remove them from the living area, that you do some quiet time, some reading, some songs, cuddles, just that little bit of preparation so they can in fact be calm enough and be able to settle to sleep. So that's both day and evening. If you think that your child finds it difficult at this age to settle, don't be afraid to extend that period when you can to 20 to 30 minutes. And that could simply be just starting to pack up and getting very busy toys out of their environment for 10 or 15 minutes, and then progressing to their room and doing some quiet time. So a small little snapshot at toddlers transitioning from 2 to 1 sleep, and we hope it helps you decide whether your child is in fact ready to do that. And I look forward to seeing you next week. Thank you. Bye.